Good morning. Hi, it's Tracy Prachu here with the RCAW. Welcome to our group of contractors logging on, and welcome to Jennifer from Safety Matters Training Institute. We're glad to have you all here. Just a few housekeeping items before we get started. Number one, Jennifer is going to be doing the presentation. Please type in any questions that you have, and at the end, we'll ask and answer all the questions. Number two, please send me an email with the name, first and last name, and the company of each person who is attending this. My email is Tracy, Tracey, at rcaw.com, and send that to me because we will be sending out your certification cards. If you want them sent to a different address than the company address, please add that to the email as well. Because people's emails sometimes don't include their names or their company name, it's kind of hard from your registration for me to know exactly where everything needs to go. So if you can do that, that would be awesome. This is also being recorded and will be available on our website by the end of today. If you want to rewatch anything, you can also download handouts. There are the slides that we have here today, as well as several other handouts. So that's where we're going. And welcome again, and I'm going to turn this over to Jennifer. Hang on.
Hi, everyone. This is Jennifer with Safety Matters. As Tracy mentioned, we're going to be doing COVID-19 supervisor training this afternoon. Just a little background on me and how I got to where I am today. I was a carpenter in the field from 87 to 99, and then I became a safety director for a general contractor in the area. And in 2008, I left and started Safety Matters. So we've been in business for about 12 years now. We're a third-party safety consulting firm. Our main goal is to ensure that our clients are in compliance with Labor and Industries Washington Administrative Codes. We do a lot of training, site inspections, assistance with accident investigations, challenges with Labor and Industries. If L&I comes on projects because of accidents, injuries, referrals, whatever the reason might be, we assist with L&I inspections, Board of Appeals, things like that. So our main goal is to make sure that everybody is in compliance with Labor and Industries and all of the Washington Administrative Codes. Today, we're going to focus on the new code, or directive is probably a better word, and that is the COVID-19 supervisor requirements. I'm going to share some personal experiences that I've had in the last couple of months dealing with L&I and contractors being shut down or being visited as a result of disgruntled employees, or L&I might just be driving by and see a construction project is up and running, and they might see something that's concerning, or they might just stop because they've been told to stop at all job sites and enforce the COVID requirements. You may have heard that phase 2 should be coming out in after June 1st. I have the directive from Governor Inslee's office for both phase 1 and phase 2. The PowerPoint presentation is going to focus on phase 1 only, because that's where we're at right now, and I don't want any confusion. If you want phase 2, I believe it's available on the RCAW website. I will also make sure that you all have my cell phone and email before we're done today. Feel free to email me, call me. I'm more than happy to assist with all this stuff, you guys. It's ever changing. It's very difficult to keep up. It's kind of become my full-time job. The last couple of months is staying current on COVID. So I'm happy to answer questions, emails, and there's no charge for it. This is sort of my way of paying it forward to the industry. I'm going to issue everybody a card that's attending this webinar today, and the cards will be valid for 1 year. As Tracy mentioned, we'll take questions at the end. The reason we're going to do it this way is a lot of questions will be answered as we go. And so it's just type your questions in, keep them in your head, take notes, and then Tracy will be the in-between for the questions and answers. Okay, with that, I'm going to move forward. The first slide talks about what is low risk. So any existing project where the scope of work, sorry, I need to, Tracy, do you know how I can minimize this? I can't see all of my slide. This right here is in the way.
I can't. Is that better?
No, it blocks a good portion of my slides.
You can go up and you can hit the little minus in the box at the top and it should minimize.
The only thing it's letting me do is hit the X. And if I hit the X, will that drop us?
Yeah, don't do
Oh, wait,
that.
maybe that'll, no, huh?
Yeah, don't do that.
Yeah, it's not giving me the option.
Or a smaller view.
Yeah, okay, wait, let me try that. Hide the control panel, let's try that. No.
Yeah, there's a little red arrow.
Well, let me try something. Okay, okay, there we go, that'll help. Okay.
Alrighty.
I'm gonna put any existing, okay, got it. Any existing project where the scope of work does not involve workers to be closer than 6 feet from one another, or projects that would otherwise require workers to be closer than 6 feet from one another are currently prohibited. Let me explain this. This has come up a lot. If employees have to perform tasks that require them to be within 6 feet of one another, is that allowed? The answer is yes and no. They will say it would have to be an essential task. I'm not really here to discuss what is deemed essential and what is deemed non-essential in the eyes of L&I. My personal opinion is this. The whole reason for opening up construction and letting projects resume is to complete the projects. The only way we can complete projects is to perform tasks to get the projects done. So in my opinion, pretty much every job you could argue is deemed essential. That said, if you have to perform a task that requires workers to work within 6 feet of one another, document. Make sure that you have some sort of a job hazard analysis, a JHA, a safe operating procedures, some sort of document that you have reviewed with your crew and that you can produce if L&I requests it, that will substantiate why you have to perform that task within 6 feet of one another. In addition to that, you will probably have to implement a barrier, put a plywood between the workers, put a visqueen barrier, even face shields. When I say a face shield, that does not replace a face mask. I specifically asked this question to an L&I compliant or consultant, and they responded with an email, and I'm happy to share this email with anybody who wants to see it. And the interpretation from L&I is this: you can wear a face shield in addition to safety glasses or eye protection and a face mask as added protection. But a face shield does not replace eye protection or face masks. It would just be an additional barrier. So just make sure that you're able to produce some sort of a job hazard analysis, additional engineering controls or PPE that you've put in place to perform these tasks that require workers to work within 6 feet of one another. And you should be okay. I can't guarantee it. I can't guarantee that L&I would deem that your task essential, but that's my advice for best practices. Okay. You gotta be kidding me. There we go. Okay. So what we're going to cover today is everything that you see here: PPE, social distancing, sanitation, symptom monitoring, incident reporting, decontamination procedures. Thank you, Tracy. safety training and exposure response and post-exposure incidents. Everybody has to have a plan, a COVID-19 plan. There's several templates that have been emailed back and forth throughout different associations. RCAW has one, AGC, ABC, MBA. If you don't have one, contact Tracy or myself and we will get you a template. You'll have to customize it. You'll have to make sure that it matches your scope of work, your type of industry. And as far as it having to be posted, my experience with L&I is this. So long as it's available upon request by employees or by L&I or any government agency that requests it, and you're able to produce it upon request, you don't necessarily have to post it. That's just a term that they use. So make sure it's available and you've reviewed it with all your employees. Okay. This says subject to inspection and job site closure. I've only had one job get shut down, and it was very early on. It was literally like the first Monday that this all came into effect, and they showed up on the job, very large project, and they shut it down because the screeners were not physically checking temperatures, and the reason was they didn't have no-touch thermometers delivered yet. They had ordered them and they hadn't come in, which was a huge problem at first. If you're having a hard time finding no contact thermometers, I was able to find them on ihealth.com. That's IHEALTH.com, and they came fairly quickly. And I think they have a pretty good supply now, and you should get them within a couple of days. But they were shut down because they weren't taking physical temperatures and the health screener wasn't trained. Health screeners have to have bloodborne pathogen training. And they also have to have training on how to take temperatures and how to ask all the questions and what to document as far as the healthcare screening questions, which we'll get into later. So that's the only site that I have been involved with that has been shut down, and it was only shut down for a day. They took care of the training, they got the health screeners, some no contact thermometers, and they were up and running the following day. That doesn't mean that there hasn't been other sites shut down. That's just the only one in my experience. That said, I have had several contractors call me because L&I has showed up because of disgruntled employees filing complaints. And so I want you to understand that that is happening. Hopefully we can avoid that. It is not what I encourage workers to do. I always want workers to go to their supervisors, their foremen, the general contractors, foreman or supervisor, and a last resort would be to call L&I. So it is not what we would encourage, but it is your right as workers. So I need to put that out there that that is happening. Okay. It says here that you have to post a written notice to your employees, subcontractors, government officials, what your scope of work is. I've been asked, can I just post the schedule? You know, honestly, you guys, this goes back to job hazard analysis. This isn't really anything new. We're all used to the term site-specific safety plan. You have to have a site-specific safety plan. Within that plan, now you have to include your COVID-19 safety plan. It's not any different than having to have a fall protection plan. It's weekly safety meetings, weekly inspections, site-specific orientations. You know, if you're installing a window, what is your job hazard analysis for window installations or siding or whatever your tasks may be. So that's basically what they're saying, is that you have to make sure you have a site-specific safety plan that now includes your COVID-19 plan. All contractors have an obligation to keep a safe and healthy work site. This is under the RCW 49.17.060. This is nothing new, you guys. Washington State, federal OSHA, we've always required that all contractors keep a safe and healthy work site. So if they feel that it's unsafe, but there isn't a COVID code that they can reference, what they will cite contractors for is not having a safe and healthy workplace. So it's sort of like it's under the good faith policy, or they could cite under a housekeeping issue, or they can cite under Governor Inslee's directive. So that's the other confusing part. We don't really have Washington administrative codes right now that address COVID specific requirements, but I was told by L&I that they can cite under the directive that was put out by Governor Inslee and his staff. Here's some links that you can go to that are helpful. The top one for L&I has changed already because of the new directive that have been put out. But if you go to L&I's website, lni.wa.gov, or you go to the CDC or the World Health Organization or OSHA, those are all great resources for additional information. Okay, we're going to talk about all of these things that you see here on this slide. And we'll start with the COVID supervisor. I've got some good news. A COVID supervisor can be pretty much anyone who has knowledge of the requirements and is on site at all times. It doesn't have to be the same person. You can have an alternate if somebody calls in sick or, you know, is out on vacation or whatever the case may be. But you do have to have somebody who is designated as the COVID-19 supervisor on site at all times. They must be aware of the requirements. They have to implement and enforce the requirements. And they have to be specific to each site, unless it's a small residential job that has 6 or fewer workers. So this came up. Let's say you have a general contractor who just has a project manager and a superintendent, or maybe just a superintendent on site. So they're just a one-man show that's, you know, managing the project. Then you have 2 roofers and a couple framers and, you know, a couple plumbers and a couple electricians, but nobody has 6 or more employees within one company, but collectively you have more than 6 employees on site. Do you need a COVID supervisor? The answer is yes. Who does that COVID supervisor need to be? L&I doesn't care. They just need it to be somebody. Somebody needs to be doing the screening. Somebody needs to be physically taking temperatures. Somebody needs to be walking around daily and enforcing all of this stuff that we're going to talk about today. I don't honestly know what's required for supervisor training, so I put together this PowerPoint and, you know, thought that it made sense because everything they're referring to is from Governor Inslee's phase 1 requirements, which is 30 bulleted items. I've had it reviewed by L&I. They don't really approve training, but they said, yeah, it looks good, you know, that it looks thorough and it looks like what needs to be covered. So I think we're pretty good. Keep in mind, like I said, though, it changes rapidly, you guys, so you have to stay on top of this. This is what's current as of today, May 21st. And I can't stress enough that your supervisor can't be roaming around and managing 3 or 4 projects. If that's the case, you need to have an alternate. So if your main supervisor has to leave and go check on another job, you have somebody else in place that can step in as the COVID supervisor. You have to talk about this weekly, guys. Make sure if you're a general contractor and you're performing site-specific orientations, you're now addressing COVID-19 in your orientations and your weekly safety meetings. If you're a subcontractor that's required to do your own orientations and you're not attending the generals, or you're doing your own safety meetings and you're not attending the GCs, you're covering COVID-19 requirements before workers start the job and weekly thereafter if they're on site for a week or more and it's an ongoing project. So just make sure you're talking about it, you're staying current, and you're making sure workers know whatever has changed, or if everything's the same, you're continuing to address it on a weekly basis. Okay, and obviously the training is so that workers stay informed. Attendance is kind of tricky now. They don't want you to grab a clipboard and a piece of paper and hand it out to everybody because of the contamination issue. So have one person write down the names of everybody who's attending, and or taking a verbal attendance. Somehow you want to document your attendance. Just don't hand an attendance roster around, because they don't want, a bunch of people touching the clipboard. And make sure that you post the requirements on your site. This is an actual posting requirement, a little bit different than posting your plan or posting your job site procedures. This is posters, and I'm sure you've all seen them. I will show you examples at the end of this presentation. I believe Tracy has these available on the RCAW website. If not, shoot me an email and I can send them to you as well. But I know Tracy has them, and I'm almost sure they're on the website. Social distancing, guys, don't gather in groups. Do your best to stagger your lunch breaks, your coffee breaks. In safety meetings, separate by 6 feet or more, the best that you can. When you're performing tasks, stay 6 feet apart. Even if you're 6 feet apart, you still have to wear all the PPE. Don't forget that. You could be 20 feet away from one another and you still have to have eye protection gloves and face masks. There's no ifs, ands, or buts about that at this point. It's 100% PPE requirement. Face masks, gloves, and safety glasses, or some form of eye protection. So stay 6 feet apart, guys. Employers need to identify high traffic areas, high risk areas, choke points in their COVID-19 plans. That would be things like lunchrooms, break rooms, job trailers, tight quarters on certain phases of a project. This would all need to be identified in the site-specific COVID plan. And obviously minimize any interactions with delivery equipment, materials, visitors coming in and out of the site. And just do your best to maintain that 6 foot separation. Again, this goes back to what we've already discussed. It says here only allow one trade or subcontractor at a time on a job site. That has not been enforced in my experience, guys. When Elle and I came to the job a couple weeks ago, Monday, and shut that job down because they weren't checking temperatures and the screener wasn't trained, there were several trades on the site, several. So I'm not quite sure why this is written the way it is, but it doesn't seem to be enforced. That said, if I'm a GC and I'm building a single family home and I have plumbers and electricians on site, I would try to schedule it to where the electricians are in one unit, and when they come out, then the plumbers can go in, and when they come out, then maybe the drywallers can go in, and limit one trade in each house at a time. If it's a commercial job, limit one trade into each unit or whatever it is that's being built, and do your best to minimize the amount of people that are in one area. But I have not seen this one trade only on a site. I have not seen this enforced at all. It would seem near impossible to me. So I can't say that they couldn't enforce it. It's just not been my experience. PPE. This is employer provided PPE. That said, if you are a GC or you're a subcontractor that has a sub tier that you're subbing work out to, you are not responsible for providing PPE to your subs employees. You're only responsible for providing to your direct employees. Gloves that are specific to the task, eye protection, which at a minimum is going to be safety glasses. If the task requires a face shield, like grinding or, you know, cutting metal studs or operating a chainsaw, you might have to have safety glasses and a face shield, or goggles and a face shield, and then the cloth mask. Are homemade masks acceptable? Absolutely. A bandana, double layered, over your nose and mouth is acceptable. Homemade cloths, so long as they're double layered, so long as they're covering your nose and mouth and they're worn constantly, you should be okay. The question came up recently, well, what if I want to get a drink of water or I need to eat lunch? Of course, you can remove your masks to get a drink of water or Gatorade, or to eat your lunch, or if you're off-site and you're going to take a smoke break, whatever. Absolutely, you can remove your masks for stuff like that. But keep them on 100% of the time, guys. And how they have to be, you know, made, there's CDC guidelines you can follow, but the best I can tell you is they need to be double layered at a minimum. Seen a lot of disposable masks out there that are not double layered, and L&I does not seem to be having an issue with that. So I would just say some sort of face cover 100% of the time. And then this just talks more about eye protection and gloves. And keep in mind, guys, the gloves should be specific to the task as much as practical, and as well as the eye protection. And again, I can't stress this enough. This is employer provided. If employees are losing their safety glasses every day, can you say, hey, dude, I've given you, you know, 4 pairs of safety glasses this week. You need to produce your own. Absolutely. Document that this is happening. Require them to come to work with their own safety glasses because you've already provided, you know, more than their fair share. That's fair for gloves, masks, or safety glasses. If the PPE isn't provided or it isn't worn, guys, they will shut the job down. Sorry, I jumped ahead a little bit. I just can't stress that enough. This is probably one of the main reasons L&I is showing up randomly, is a compliance officer's driving down the street and they see workers working without PPE. They will stop, guys. They're being told by their bosses that they can't ignore that. It's, you know, deemed imminent danger, and they have to address it. So keep it on, guys. And remember, I was a carpenter for 12 years. I cannot imagine working with a safety glasses and a mask and gloves all day, every day, guys. So I am so empathetic. I try my best to get, you know, superintendents and foremen that might, you know, they're irritable. We're all irritable, and they're screaming at guys because they're not keeping their PPE on. And I so get it. And you know, we're going into some hotter months, and we had a couple of hot days a week or so ago, got into the lower 80s, and I feel your pain. I'm sorry that this has happened. You guys kind of get the brunt of it, having to wear it all day, every day. But I'm just the messenger here, and keep in mind, there's just a lot of irritability right now, and you guys are the ones, you're the frontline workers in my eyes. You're like the nurses and doctors in the ER. Now you're out in the field, and you're the construction frontline workers. And it's got to be very cumbersome, and I empathize, but it's where we're at today. Okay, wash your hands, guys. Wash your hands, wash your hands, wash your hands. You know, we're all adults here. If you're coughing, sneezing, blowing your nose, you're supposed to leave, right? Because those are signs, potential signs. But what if you have really bad allergies, or you have something else going on that you know is not COVID-19? You know, it's just that you're prone to a cough because you're a smoker, or you're sneezing because you have allergies, or whatever the case may be, guys. Just, you know, avoid touching your hands, you know, sneeze into the inside of your arm versus your hands. All the common sense, you know, hygiene that we're all taught. Employers are required to have running water with soap. It's supposed to be tepid water. It don't know how much that's really being enforced. I was told at the beginning it was going to be very enforced, but I've had L&I out on a couple sites where tepid water was not available. They had hose water, they had soap, they had hand sanitizer, and they were showing best practices and doing the best they could do. They weren't shut down, they weren't issued citations, but there was a warning, and they did say, hey, you can get a Coleman stove and a bucket of, a stock pot of water and boil some water and mix it with some cold water in a 5-gallon bucket or a big orange igloo or whatever and create tepid water. So that, there's all kinds of ways out there to do this, guys. You can rent hand washing stations that have tepid water. They're a little spendy, but bottom line is water must be provided on the job with soap. And so alcohol-based hand sanitizers are not a replacement for the water. They can be an addition to. So you can have both, but you can't have just hand sanitizer. It's just an added, an added thing that employers can provide for their employees. And this isn't anything new, you guys. I got to tell you again, as a carpenter that used to be in the field, I kind of wish I had hand washing stations on every job that I ever worked on. I really feel strongly that we need a place to wash our hands. We work in, questionable environments sometimes. And, before you eat your lunch or drink your coffee or whatever, it's nice to have a place to wash our hands. And this is not a new code. This has been a Washington administrative code since the 1970s. It's just not been enforced over the years. I have seen it enforced. I have seen where a disgruntled employee has called L&I back in the 80s and the 90s and 2000s and said, hey, man, we don't have running water out here and I want to wash my hands. And they have been issued citations and been forced to rent hand washing stations. So this isn't anything new. It's just now it's being enforced. Okay, like you've heard on the news over the past few months, they've been talking about, don't touch your face. You got to wear a face mask, but don't touch your face. So that's kind of challenging. I feel your pain there, guys. 20 seconds of hand washing, sing the happy birthday song, the ABCs. That's what I remember being taught as a kid. And use that hand sanitizer in between hand washing. I think I've drove that point home. Make sure that somebody's going around and wiping down your tools, your lunchrooms, your microwaves, your conference tables in the job trailers, your ladders. I just can't stress this enough. Your COVID supervisor can designate somebody to grab some, Clorox wipes or Lysol wipes or soap and water and wipe everything down as often as you can. High touch areas, doorknobs, handrails in stairwells, tools, and just keep the site as clean as practical. As far as how often do you have to clean, it doesn't really state. I think somewhere I saw it had to be done every couple of hours. Should you keep a log? I think that's a really good idea. I think as part of your COVID-19 plan, you could have a cleaning log, kind of like what you see in the honey buckets where they have that table where somebody puts the date and the time and their initials. We see it on fire extinguishers when we're checking fire extinguishers. A log like that, that's a daily cleaning log, I think is a really good idea, which, kind of supports that this COVID-19 supervisor is a full-time job, and having that supervisor do the temperature checks every morning, having them do the health screening, documenting everything that's required to be documented, which we'll discuss in a bit, and then going around and doing continuous cleaning. It could, on a large job, it could, be justified that that full-time person only does that task. But the good news is they can do other tasks. I meant to say that earlier. If you have your foreman, your lead, a laborer, heavy equipment operator and they are also your /COVID-19 supervisor, that's okay. Your supervisor is allowed to do other tasks. It's not like a low sloped roof monitor or a confined space attendant. That said, if you are assigning somebody to be a safety monitor on a roof, low sloped roof, or you're assigning somebody to be an attendant outside of a confined space, they can't be the COVID supervisor while they're performing those tasks, because the code clearly states that while acting as a roofing monitor or a confined space attendant, you cannot perform any other tasks. So I just want to make that clear. But your COVID supervisor can be an individual who does perform other duties. Okay. Follow the CDC guidelines on hygiene, guys. It's the employer's responsibility to make sure disinfectants are available. If you're working with certain hazardous chemicals and there's certain requirements for, cleanup or first aid procedures or anything like that, you would have to follow the safety data sheets. But as far as cleaning, diluted bleach is ideal. There's all kinds of products out there. Those have to be provided by the employer. And if they've been used, obviously they have to be replenished. If you're working in an occupied home and there's some residents that might be in the area, make sure the residents are always 10 feet minimum, at least 10 feet away from the activities, and that you're cleaning the area that you worked in as far as occupied units before you arrive, after the tasks, and before you leave. But 10 foot is the separation between residents and workers. If an employee reports feeling sick and goes home, regardless if it's COVID-19, they could just have the common flu or cold or some other medical thing going on. We don't know. The testing isn't instantaneous, even if they were to get tested immediately. So that area needs to be cleaned regardless. So you don't want to go around and tell the crew who the individual was. Keep their privacy, obviously, keep their identity confidential, but make sure that you've made everybody aware that, hey, somebody went home today, and you're cleaning any area that they may have potentially contaminated. Okay, what are the symptoms? This is kind of what's on, not kind of, this is the questions, some of the questions that are on the healthcare questionnaire. We take your temperature with a no contact thermometer. If it's 100.4 or greater, you're going to be sent home. That doesn't mean you have COVID. Because you have a fever doesn't mean you have COVID. Because you have COVID doesn't mean you have a fever. But if your fever or your temperature is 100.4 or greater, you will be sent home. Shortness of breath, muscle aches, fatigue, loss of taste or smell. If you're just feeling flu-like symptoms run down and you've got a fever, again, it doesn't mean you're positive for COVID, but you will be sent home. And the results of your healthcare questionnaire answers will be documented. You do not have to document everybody's temperature. If everybody's measuring between 98.6 and 99 or whatever, you don't have to write every single one of those results down. It's a pass or fail thing. We are recommending that if you do test somebody and it's 100.4 or higher, you would document that. You would document that you sent them home, and you would document the results of all the other questions, but you don't necessarily have to document every single result of temperature. You can if you want to, it's just not required. Okay, again, send that individual home if they're at 100.4 or higher. Screen all the workers, ask if they have a fever, cough, shortness of breath, fatigue, muscle aches, a new loss of taste, or smell. And again, if they're symptomatic, they must be sent home. I'm going to show you a healthcare questionnaire that we use. It's again very generic and has all of this information on it. Real quick, let me touch on this. Let's say you have transient workers. You have a visitor showing up that's a city inspector or an L&I compliance officer or somebody delivering Culligan water or, you know, roofing materials. Do you have to check their temperatures and screen them? The answer is yes. If they refuse, I have to tell you that L&I's answer is send them home. If they refuse, and they are a transient worker, I would maybe say, well, did you get your temperature checked at your office when you arrived on site this morning? Or did you take your own temperature this morning? And if they say yes, just document that it was verbally verified and that they're a transient, you know, and when I say transient, I just mean they're going to be on your site for a short period of time, but then run them through the health care questionnaire at a minimal. If they refuse, all I can tell you is we're being directed to not let them work and leave it at that. If you develop signs and symptoms, report it to your supervisor. You will be immediately sent home. The area will be cleaned that you worked in, and you won't be able to return until you have a medical evaluation. I had this happen. I have employees that are out assisting with COVID-19 supervisor tasks, and we have one job that we're visiting. We're on site every morning from 6:30 to 9:30, taking temperature, doing the questionnaires, doing some cleaning, doing some enforcement, that sort of thing. One of my workers developed a fever. He called me not yesterday, but the day before, and I directed him to stay home. He got tested the day before yesterday at 3:30 in the afternoon. I just found out about an hour ago he tested negative. But I did notify all of the clients that he has visited this week and last week and let them know that he was testing. I just said one of our employees that has been out on your site. Of course, we're a small company, so they pretty much knew who it was, but it was fine. I got his permission to do this. And then he came back negative, and I sent out an email to all of my clients that I had notified that it was negative. We're just doing our best to show our due diligence. So the good news was that it was negative. The bad news is he still doesn't feel well. So he got something going on, but it wasn't COVID-19. But you know, I have the results now from him in writing. I have the results of his tests, so I will keep that on file, and now he can return back to work. He's going to take tomorrow off and come back after the long holiday just as an extra precaution, but that's how we handled it, and that's what I would recommend. Okay, clean the area if they're sent home. We talked about that. Document that you clean the area. Your policy has to state that employees are encouraged to report if they're not feeling well, if they've developed any signs or symptoms, and also if they've been in close contact with somebody that has a confirmed positive case. So it doesn't mean a family member. I have a family member, a nephew who's in the trades that was tested positive for COVID-19, but I haven't been around him for 6 months. So I know him, he's a loved one, but I haven't been around him. But if you live with somebody that's tested positive, or you've been around a worker who tested positive, you may have to report that to your employer and just show your diligence, guys. Be diligent about this stuff. I can't stress that enough. That's where what we really need to control is quarantine people that have been tested positive or have been around people who have tested positive. If you develop symptoms of an acute respiratory illness, seek medical attention immediately and inform your employer immediately. Again, if you have a family member that you live with or that you've been in close contact with, you have to quarantine. I will tell you, L&I is not enforcing this. In phase 1 of Governor Inslee's reopening requirements, bullet number 28 states that if you test positive or you're around somebody or a family member does, you have to self-quarantine and isolate for 14 days. I'm not saying you don't have to do that. It's the right thing to do. But L&I can't enforce that. They have no way of knowing that you're telling the truth or not. So they can't cite an employer if they find out that the individual didn't quarantine. But I can tell you as an employer, like let's say my employee did test positive, there's no way I could let him go back to work for 14 days. If I did, could I be in some hot water for that? Absolutely. But it's a tough one for L&I to be able to monitor or enforce. So I'll just keep that in mind. Okay. Whoops. Failure to comply with these policies will also result in a worker being sent home. If a worker doesn't feel comfortable going back to work and they refuse to go back to work, can you force them? The answer is no. Are they able to use paid time off, PTO, or can they stay on unemployment or go on unemployment? Guys, that is a human resource question, and I'm not going to go down that road. That's a company policy thing. That's based on the individual. My recommendation is don't force anybody to work if they're not comfortable working in this current environment. And whether they can collect PTO or unemployment or whatever is not a safety thing. It is an HR thing. So take that up with your HR department. I don't have the answers for that. Any worker coming on a construction site that isn't contiguous with Washington, anybody that is not other than Washington, Oregon, and Idaho, if they are coming from New York, Michigan, wherever, they have to self-quarantine for 14 days. Ask them the question, did you quarantine for 14 days? If they said yes, verify verbally. That's the best I can tell you to do in that circumstance and document it. If a worker is confirmed to have COVID-19, the employer must inform all the workers, again, keep their identity confidential, and offer workers information on the CDC guidelines, the quarantine requirements, seeking medical attention, everything that we've been talking about. But you do need to notify all projects that the worker has worked on. We have an individual that tested positive. He's worked on these jobs, he or she. You do not give out their names. Again, I talked about this already. If a worker doesn't feel comfortable, don't force them to work. Whether they get PTO or unemployment, take that up with HR. A daily attendance log, that is the 30th bullet, the last number 30 bulleted item in Governor Inslee's letter for phase 1. It does say that we are required to log daily attendance. I have been told L&I is not enforcing this. I think it's a really good idea. I would do my best to document attendance. We can't have people signing in on the same attendance log and touching the same clipboard. So you should, again, your COVID supervisor should be tasked to doing this, in my opinion. I would do it, even though L&I is saying they won't enforce it. It is part of Governor Inslee's requirement. So do your best, guys. That's all I can tell you. Log that Culligan water guy, the guy delivering roofing materials, the guy that shows up to clean the honey buckets. Log it to the best of your ability. And the log includes the name, the phone number, email address of the workers and visitors. People might not be comfortable giving out their cell phone. Ask them for their company landline, or just ask them for the name of their company. Ask them for their company email, not their personal email if they're not comfortable giving personal information. Get as much information as you can and keep it, confidential. Okay, I'm going to summarize with this. I think everybody remembers 9/11 and the panic that we all felt and the fear that we felt and the challenges with traveling and, you know, we had to take our shoes off and we couldn't carry more than 3.5 ounces of fluids, and we couldn't bring, you know, water anymore. We go through these body scans. To go to a Seahawks game or a Mariners game, they're going to pat you down. They're going to put you through a metal detector. They're going to search your bags if they even let you bring a bag. I remember going to a Husky game and your bag had to be a clear bag. You know, the world changed after 9/11, guys, and we all felt like our freedoms were taken away, like our constitutional rights had changed. And then it seemed like as time passed, we calmed down. We got used to taking our shoes off to travel through the security. We got used to being patted down and having to run our bags through screens. And, you know, it just kind of became a way of life. This is much more extreme. The whole world has shut down. So it's not isolated to the United States, but it is something that has changed our entire world. We will get back to some sort of normalcy. It's just going to take a while. Be sensitive to what everybody's going through. Try to watch your irritation level. Be patient. Don't panic. Come together as a team to make this happen. If you have to perform tasks that are within 6 feet of one another, do your best to document why, ask opinions from all the workers involved if they have some good ideas of how to implement additional barriers or PPE or safe ways to do these tasks that require working closer than 6 feet. And just keep a clean job site, guys, and just remember that we will get back to a new normal. I don't think our life will ever be what it was before coronavirus, but that was the same way we were thinking when 9/11 happened. So be patient, work together as a team, do your best to enforce PPE, social distancing, and clean, clean, clean. Okay. I'm going to go ahead and open it up for questions now, and then I am going to show you some other things. But before I move forward, I kind of want to stop for a second and give me some questions. I think Tracy's going to come back on board and she's going to field the questions for me.
So the first question I have here is, I have 70 employees in my company, but only 4 on any given residential site. Do I need a site supervisor?
If the 4 on your site are on a site where there's other trades, so you have your 4 employees and 2 from another site, now you have 6, somebody has to be the site supervisor, the COVID site supervisor. I was on a webinar about 3 weeks ago with Ellen and I on the panel, and that exact question was asked, formulated a little differently, but they said yes. Somebody, not necessarily from your company because you only have 4, but now collectively you have 6 or more. The answer is yes. Somebody on that job must have a site supervisor. My first reaction to this is, if L&I comes on site and let's say you have exactly 6 employees, 2 electricians and 4 roofers, but nobody is providing site supervisor tasks. Nobody's checking temperatures. Nobody's asking the questions. Nobody's doing the screening. You're both going to get cited. That's what's going to happen. So collectively, you need to share the responsibility, in my opinion. You need to come together as a team that's working on a project together and decide who's going to provide these tasks. Maybe share it. On Tuesdays and Thursdays, the company with 2 employees will do it, and on Mondays, Wednesdays, and Fridays, the company with 4 employees will do it. That's my best answer. L&I doesn't say who has to, but somebody has to. Next question.
Next question, are Washington, Oregon, and Idaho all following these rules?
I don't have the answer to that. As far as I know, Oregon is. I'm on jobs in Hillsboro, Portland, and Tigard, however you say that, and Fairview, Oregon. My contractors that are on those projects in Oregon are following these rules. I don't have any sites in Idaho, so I don't know. I've been so busy just keeping up with Washington State and Oregon. I couldn't tell you about Idaho, and I couldn't tell you if Oregon's are identical, because these directives are coming out from our governors. So Governor Inslee's directives and how he's reopening and the 4 phases that he's implementing might be somewhat different than Idaho and Oregon, but they border Washington State, so they're considered contiguous. That's why we are allowing Idaho and Oregon workers. I would say you should probably go to Oregon OSHA's website, and Idaho follows federal OSHA. So they're probably following the basics, but it depends on their governor's directives. That's the best answer I've got for you. I will do some research and try to see if I can come up with a better answer and get that back to Tracy. Okay, next question.
Next question, does 6 collectively include homeowners and or transient workers?
Does what? I didn't hear the.
Does 6 collectively, does 6
No, okay, good question.
homeowners and or transient workers?
Oh gosh, that's a really good question. I don't think so. I will ask that question. I have not heard this one yet. That's a great question. I think 6 or less refers to full-time workers, not residents. Now it would management would be included, you know, project manager, superintendent. But if you have visitors coming, delivering water, cleaning a honey bucket, or delivering materials, I don't believe that would, you know, if you only had 2 workers, but throughout the day you had 4 people show up randomly for various reasons, that would not be included. That's what my gut tells me. I have not had this question yet, so again, I think it's full-time workers. Go ahead.
Okay, that looks like that's the end of the questions, unless there's anyone else out there with some questions they want to type in real quick. One thing I wanted to say is towards the bottom of your dashboards, it will say handouts, and it says 4 of 5. Down there are the slides, phase 1 construction that you just saw from Jennifer. There's 2 DOSH directives, one on masks and one on coronavirus protection. And then there's also the COVID-19 phase 2 construction safety guidance. So you can pull all of those off of this webinar and pull them into your computer and print them. They're all in PDF format. And again, please send me the list of whoever was on this so I can get you your certification cards. Please send me your names, full names and company to Tracy, Tracey, at rcaw.com. I'm going to turn this back over to Jennifer.
Okay, thank you, Tracy. What you're looking at on the screen right now, guys, is I sat and read phase 1 and phase 2. There's 26 bullet points in phase 2. There's 30 bullet points in phase 1. They're almost identical, except for some of the information, the same thing is said in different bullet points, and the numbers have been changed, and I don't know why that is. But I can tell you right now, one of the biggest differences that I have seen in phase 2 is the social distancing. Phase 2 says that, if you look here, guys, it says under number 4 under phase 2, social distancing of at least 6 feet of separation must be maintained by every person on the work site at all possible times. If you look above, it says social distancing number 5 for phase 1, at least 6 feet of separation must be maintained by every person on the job site at all times. The word possible has been added in. This is where that JHA comes in. I'm already recommending that you do this JHA if you have to work within 6 feet, but now I think they're gonna be a little bit more lenient in phase 2 of allowing work within 6 feet. And, you know, so long as you're still documenting how you're justifying that. So the biggest difference there is that word possible. Another big change is the PPE section. I'm scrolling up here. I'll send this to Tracy, and Tracy, you're more than welcome to share this, because it's hard to decipher phase 1 from phase 2. This is, I want to say, this is my interpretation, you guys. you may interpret it differently. And so don't take this as, you know, a code or the correct interpretation. This is just me really dissecting this stuff. If you look at PPE section for phase 1, there's 1, 2, 3, 4, 5 bulleted items. Phase 2 only has 1. Phase 2 only says that eye protection is required. Employer provided PPE, that's all it says. It does not say gloves and masks are provided. I can't guarantee that phase 2 is going to be kicked off June 1st. That's the latest that Governor Inslee has said. But there is a statement on page 2 of phase 2 that says PPE such as gloves, goggles, face shields, and face masks as appropriate or required for employees for the activity being performed. I'm feeling like maybe if you're more than 6 feet apart, you'll be able to eliminate the masks and the gloves. Don't quote me on this, you guys, but it's been taken out of the PPE section. Or if the task doesn't require any kind of a respirator or gloves. But if you're within 6 feet of one another, I think you'll still have to wear the face masks and the gloves. I'm trying to get some clarification on this, and L&I has not gotten back to me yet. This is the big one, health screening. Phase 1, we were required as an employer to physically take temperatures. Phase 2 says, number 22 there, ask employees to take their temperatures at home prior to arriving at work or take their temperatures when they arrive. You still have to have a COVID supervisor. You still have to do the healthcare screening. But if you want to ask employees if they took their temperature, and if, you know, obviously if they're there, they must have passed, and document that they verified it verbally, that may be an option. Trying to get some clarification on that as well, guys. Bullet number 27 has been completely removed. Number 27 in phase 1 basically said that if an employee doesn't believe that it's safe to work, they shall be allowed to remove themselves from the work site, and employers must follow the expanded family and medical leave requirements. That is not in phase 2. So what I'm taking from that is that employees aren't going to basically have the right to say that they're not willing to work. I don't know, again, you guys, this is just the differences that I'm seeing between the two. Like Tracy mentioned, the phases are available on the website. You can read through them and decipher through them and interpret them yourself. This is my interpretation. So some minor changes, but also some big changes, and I'm more than happy to share that with you. Real quick, I mentioned that I would show you what a copy of a questionnaire looks like. Make sure that if you are using healthcare screener, or, you know, somebody's being your healthcare screener, they've been trained, they have some bloodborne pathogen training. Usually if they have a CPR first aid card, they most likely receive some sort of bloodborne pathogen training in that class. If not, make sure they get that training. This is an example of the questions that we talked about in the bullet point of how you can document, and this is a sheet that is a week's worth for one individual, so that's an option. You can shorten it a little. It says here to document the results of the daily temperature. Pass or fail is good. You don't have to put down the exact temperature, and I don't recommend it unless it's a fail. So the last thing I'm going to wrap up with is these are the posters. So if you don't have these posters, they're available on the CDC website. I believe L&I has some posters you can print and post as well. They're available on the RCAW website. So these are just some different posters that you can print and post. I would post them where you post your all-in-one labor law posters that talk about, you know, your rights as a worker and if you're injured, things like that. Or just print them and put them in your site-specific safety plan alongside your COVID-19 plans. But ideally, they should be posted unless you're in like dirt phase and there's nowhere to post things. They could say, hey, you need to build some kind of a plywood bulletin board or whatever and post them. That, you know, that is something that L&I could enforce. So get these posters up. Get those healthcare questionnaires filled out daily. Keep a really good log, document, and just, you know, guys, show your due diligence, implement best practices. and you should be okay. Okay. Any other questions, Tracy?
I do not see any other questions. Thank you for those who have been sending me emails with your information, and keep that coming. And Jennifer, if you could send me all of those posters, then I'll figure out which ones I have and which ones I don't have, and get them up on the website by the end of the day with all the other documentation that we have here.
Okay, and if we still have people online, I'm gonna do something real quick here. I'm gonna put my email on top of this handout where I've deciphered between phase 1 and phase 2, and also my cell phone. Please, I can't encourage you enough. Call me if you have questions, guys. That's what I'm here for. This is what I do pretty much 24/7 these days. And I'm more than happy to help where I can. I will try to get some clarification to those questions that were asked about Idaho and Oregon, and are transient workers or visitors included in the six employees. I'll see what I can get for answers. Okay, I think we're done.
Yes, it looks like that. Thank you very much for all of you who attended. And again, I'll get all of this information up on our website, as well as a link to the recording of this, if there's anything that you want to revisit. And I want to thank Jennifer for joining us today and taking the time out of her day and providing us all this great information. So thank you all for attending, and we will see you soon.
Thanks, guys. Have a great long weekend.
Bye.
Bye-bye.